Okay, so today we're going to talk about ibuprofen. A couple weeks ago, I had a headache and I got some ibuprofen. And as I was taking it, I was thinking to myself, let me make a video about ibuprofen because I'm sure a lot of you guys don't know how it works. And I think this would be a great opportunity to provide some insight into what it is. So first, where does this name ibuprofen come from? So we're going to go over here to number one. In this structure right here is ibuprofen. It is called isobutylphenylpropionic acid. It's a long name. Don't worry about the details. What we're going to focus on is how ibuprofen gets its name. So iso is I, butyl is bu, and the other two are interesting. They're kind of flip-flopped. Propionic is pro, and phenyl is fen. So we got iso, I, bu, pro, fen. So that's where we get the name from. So now on to number two. What is it? Ibuprofen is in a category of drugs called non-steroidal anti-inflammatory drugs, shortened NSAIDs. And when you read about these or hear about them, they're usually called NSAID pain relievers because that's what they do. They relieve pain, amongst other things. NSAIDs were synthesized in the 60s. In other words, they were created in the 60s, and they're called non-steroidal to distinguish it from steroids, namely anabolic steroids, which are the steroids that people take to, get the big muscles. Those are also used for arthritis and medicinal purposes. Anabolic means to build up. And then number three, ibuprofen reduces inflammation and pain, inflammation being the general response that our body makes to produce pain and other things like that. So that's a general overview of some of the definitions. So what are NSAIDs? Earlier I said they are non-steroidal, right? They're not steroids. Anti-inflammatory, they reduce inflammation, and they are therapeutic drugs. So NSAID is a class of medications. We're number one. These classes of medications reduce pain, fever, they thin the blood out, and so they'll reduce blood clotting, and they reduce general inflammation, which includes all these other things I mentioned. The inflammatory response of the body, it kind of reduces that. It keeps it from working well. The common uses for NSAIDs are headaches, cramping, specifically from periods, and I am going to provide a little slide on that because I think it's interesting how NSAIDs reduce the pain. And I have a little thing here, use with caution. I'll kind of give you guys some info onto why that is. And they're also used for cold, flu, aches, and pains, like I said before. I thought this was just interesting right here. Aspirin is an NSAID, and salicylate is one you probably haven't really heard of. This is used for arthritis. And they come from the same family, which I'll talk about right now. Okay, so let's get into some of the nitty-gritty. I'm going to try my best to explain this as best as I can. Pretty much all drugs come in families. Think about it like this. Let's say you have a sibling and you are both offspring of your mother and your father. Both of you have your own characteristics, physical characteristics, mental characteristics, etc., but you come from the same base material, which is the genetic material from your mother and your father. This is how these drugs work, specifically prescription drugs and a lot of chemicals. So over here, we have salicylic acid. So salicylic acid is the parent molecule to aspirin and salicylate, these two molecules I showed you earlier. Now, the question is, how is it that aspirin and salicylate come from salicylic acid? They have to have the same foundation. So let me show you how we can see that visually. So if I remove this H from salicylic acid, this structure from aspirin, and this big structure from salicylate, you'll see now that they are the same thing. Oxygen, oxygen. Oh, here's what I'm going to do. Let's see if I can do this with one hand. There you go. And oxygen, this carboxylic acid here and here, they're the same. This ring, and this ring. As you can see, they are the same thing. You can see that this parent structure right here gives birth to aspirin and salicylate. But what you're doing is, let me add these back on, What you're doing here is you're adding different pieces to this base structure to give birth to new molecules. You can think about a lot of this stuff like Legos. Okay, I have a little Lego over here. When you're building structures with Legos, you can build two structures with the same foundation, but they can look completely different, but they have the same foundation. This is how these drugs operate, and a lot of molecules in general. And NSAIDs are a category of drugs that have these parents, and these parents give way to substances like aspirin, ibuprofen, stuff like that. Let's go down here, number 2, and give another example. So ibuprofen and naproxen, some of you guys might have heard of, it's another NSAID, come from this structure over here, 2-aryl propionic acid. And don't worry about the long name. What we're gonna look at is the visuals. So here, let's do this. Let's take away this little ring structure. Let's take away this right here. And what we see is this. We have a ring here, a ring here, a ring here. This little CH3 with a squiggly line just means that this group can be in any position. So we have a CH3 group, CH3 group, CH3 group. Then we have this oxygen group, oxygen group, oxygen group. And just like the last example, we can see that the foundation is the same. But what's different is the pieces you attach to it. And that's what this little R group is. This R group is essentially one of the pieces to a Lego. You can kind of plug some stuff onto it and attach things and create different molecules. In this case, we are attaching these groups to create ibuprofen and naproxen. And again, these medications are the same principle. It's like Legos. You're just attaching different things and they happen to do similar things. I hope that made sense. So let's talk more about how these things work. So I'm going to try and take this and make it as simple as I can. So let's go to number 1. Most of these drugs, well, these NSAIDs, are what are called non-selective inhibitors. NSAIDs aren't always this, but I'm just going to talk about this because it's way too complicated to get into this. If something inhibits something else, it stops it from working. And here we say these things are non-selective. So let me give you a practical example. When you're younger, you had physical education class, right? PE. And oftentimes you'd have sports you would play, and you'd pick out people, or you'd be picked out to play these sports. In this case, you got 2 options. A, you care about who you choose, right? You're selective about who you choose. You're gonna choose the people that are gonna win you the games, the most athletic people. Or you are non-selective. You don't care about who you choose. You can just choose anyone because you're just trying to play or have fun. So you can be selective or non-selective. This is how a lot of these NSAIDs work. So let's talk about this selection process. So in our body, let's go to 3 over here. We have this enzyme called cyclooxygenase. It's a complicated thing. We need to know that enzymes increase the rates of reactions. They speed them up, okay? Let's just say speed. These specific enzymes that these NSAIDs, these pain relievers, act on are called COX-1 and COX-2. Let's talk about what they do. For over here, number 2, COX-1 goes on to aid in stomach lining protection, right? The tissue that lines your stomach. It aids in kidney blood flow. The kidneys are these organs that filter things in the body, and they aid in blood clotting. And COX-2 mediates the inflammatory response. And this is pain, fever, aches, all that stuff. Those responses that we feel are a sign that our body is working well and doing the things it needs to do. So what do NSAIDs do with this stuff? What NSAIDs do is they bind to these enzymes. These enzymes have receptors. So think of it like this. You plug up a light to turn something on or to turn something off. This is what NSAIDs do. They plug up to these enzymes, and in this case, they inhibit, right? So they stop them from working. And when you stop them from working, you have effects. In this case, for COX-2, you reduce inflammation, pain, and fever, which is why you take it for a headache. Or COX-1, if you need to thin your blood out, you would take it for that because you're stopping that blood clotting mechanism. So these NSAIDs are non-selective. They'll bind to both because they don't care which one they bind to. And it's usually both of them. And here I say they're not built for constant use. I'm going to explain this in a few minutes, but first I want to talk about something that's of interest to me and I think others. So let's briefly talk about the menstrual cycle. It's very complex. I'm not going to get into all of it, but I want to talk about cramps. I am not a woman, but I do know that these things are absolutely horrendous and they're very, very painful. So I want to teach you guys about how this kind of works. So in the menstrual cycle, the endometrial lining breaks down. It's basically the tissue that lines the uterus. Once that breaks down, there's bleeding. That's where the bleeding comes from. And this is just a very basic overview, by the way. I'm not an expert. But when that lining also breaks down, it activates that COX-1 and COX-2 enzyme, specifically from what I understand, COX-2. And we said that COX-2 mediates inflammation, the pain, fever, things like that. And in this case, it activates these molecules called prostaglandins. I'm not going to talk all about that, but it mediates pain, which causes cramping. So that's why there's cramping. Once the lining breaks down, it signals these molecules to initiate pain, which is cramping. Now, if you don't want cramps, you're going to want to stop COX-2 from working in COX-1. So this is where NSAIDs come in. This ibuprofen will come in and plug up to that enzyme and inhibit, right? It's a non-steroidal anti-inflammatory inhibitor. So it's going to inhibit that system and keep it from working, thus stopping cramps. And again, I have a little disclaimer up here that they're not supposed to be used. This is not supposed to be used as a constant treatment, especially at consistent high doses. And I'm going to talk about that right now. So this slide I have titled harmful or helpful. Let's go to number 2. We said before that ibuprofen is non-selective, will bind to COX-1 and 2. And we know that COX-1, aids in stomach lining protection, kidney blood flow, blood clotting. COX-2 mediates inflammation, all that stuff. Like I said before, when these molecules plug up to these enzymes, they stop them from working. Well, let's talk about what happens when they stop them from working. So if you stop COX-1 and 2 from working, and these effects are from constant use and overuse. What's going to happen is that it's going to result in stomach ulcers. That lining isn't protected, so you're going to have sores on the stomach from constant use, stomach bleeding. Because that lining isn't protected, you're more likely to bleed, which is obviously not fun. Kidney damage, liver damage, these are some of the adverse effects. Then COX-2 inhibition produces high blood pressure. That's what hypertension means. Kidney damage, liver damage can increase the risk of stroke and heart attack. Now, this is a controversial. There are some physicians, scientists who feel like NSAID pain relievers are not helpful at all, but they do provide some sort of relief, but they're only meant to be used temporarily. These things are not safe if you're using them consistently. I'm not a doctor, but what I do know is that these drugs are not meant to be used to constantly treat an issue. There's talk right now in the medical community about the use of aspirin. A lot of people will take baby aspirin to thin their blood out to reduce risk of heart attack and stroke, or if you've already had one of those things, to reduce the risk of it happening again. And there's some data showing that might not be helpful because these drugs have a very interesting safety profile in that they're not that helpful in the long run if they're taken too much. I just thought that was important to know. So let's take a break from the complex stuff and get into some interesting things that I find about pretty much all drugs. So we have these plants, meadowsweet and willowbark. The Native Americans, among other cultures, used a lot of different plants for medicine. In this case, meadowsweet and willowbark, I think, were dried out and used as a powder. I don't really know, so don't quote me on that. But I do know they were used as medicine because they contain this molecule, salicin. Salicin, once it was discovered, was turned into salicylic acid. Some chemists turned it into salicylic acid, which then was used to create aspirin. A lot of drugs we use are based off of natural products, which I find very, very interesting. So real briefly, I just want to show you guys again how these things are the same. Well, they're based off the same thing. So we have this ring, oxygen, oxygen, this oxygen group. Just so you know, for people who might be a little anal about some things, these oxygens will have other stuff attached to it. I'm just giving you guys these examples just for the sake of simplicity. So This aspirin was created off of this natural product, which I found really interesting. There's a lot of cool applications and stuff like that. Just wanted to talk about it. So let's get into the summary. Briefly, we talked about ibuprofen, where the name comes from, that is a non-steroidal anti-inflammatory drug, and it reduces inflammation and pain. Then we got deeper into NSAIDs, how these NSAIDs reduce inflammation, pain. It is a class of medications that are used for a variety of different things. And then we got into these families, these drug families that have the same parent, but they have different things attached to them. And we made an example of aspirin, and we also made the example of ibuprofen and naproxen. They have different pieces like these Legos, but they all have the same parent structure. They have that same genetic material, if you will. Then we got into the mechanism of action, how these things work. They're non-selective, right? Like that sport you're playing in physical education. Bind to COX-1, COX-2, and they inhibit, they stop these things from working, which produces the effect you want, but has some downsides as well. Then we talked about cramps in the menstrual cycle, how this works a little bit, and how these drugs, these NSAIDs, prevent cramping by stopping these enzymes from working, but there is a danger and there's a downside. And the downside is that when you stop these things from working, you're going to experience a lot of adverse effects you do not want. And this is from constant use, especially in high doses, but specifically just constant use of these drugs. Stomach issues, organ damage, heart attacks, strokes, stuff you do not want. It has some pretty nasty side effects. So there's debate on how helpful these things actually are. And then lastly, we got into some interesting facts about how a lot of these drugs are based on natural products. In this case, aspirin comes from a derivative of this molecule that's present in these natural plants. So that's all I got. I thought it was interesting to teach about how this drug works and how some of these drugs we take every day operate. So as always, thank you for watching and listening. Please like, comment, and subscribe. Tell your friends, and I'll be back soon with another video.